Now, I've spoken a lot about bone infections. So we're moving to another part of the bone infection. And for this part of the bone infection, we're trying to look at like what are the things that could make it very easy for you to have a bone infection. So I'm coming. So what are the things that could make it easy for you to have a bone infection? What are the factors? So bone infection is what everybody knows as osteomyelitis, you know. So it's more likely to occur due to several reasons. Okay. And a summary is because when your body's immunity is not able to stand out for you, you know, to have these issues coming. So diabetes. So diabetes could cause poor circulation of blood. You understand? Poor circulation of blood. So diabetic patients usually have all those wounds for a very long time. So if you have wounds for a very long time, it's not very easy for infections to track. You know, infections can now be able to track into, the wound and get to the bone. Smoking. Smoking reduces what the blood flow and oxygen supply to the bone tissues generally. You know, impairs healing and also increases what the risks of infections coming up. You can pause to observe this. So chronic health conditions like have kidney failure, vascular disease, all these conditions they used to kind of like step down your immune system. So recent surgeries or trauma, open fractures, orthopedic procedures, surgical implants like all those plates and screws. You have a weak immune system, you have HIV and AIDS. It makes the blood spread more likely. So also bloodstream infections. So germs from other parts of the body, can now go into blood and spread up to when it gets to the bone. So children and elderly, in children, they are most likely to have all those blood spread, you know, and elderly are also more likely to have all those chronic conditions and also reduced immunity. Their immune system is weaker than the normal, person.